Good afternoon. Welcome to the fourth international webinar of 2022 organized by Vets and Clinics Vet Advance. My name is Alba Martos. I'm the international vet in Affinity Pet Care. And today I'm very happy to be here with Jordi Puig. Good afternoon, Jordi.
Good afternoon.
He's an European and American graduate in internal medicine, and nowadays he's working as a co-responsible in the Ars Veterinaria Vet Hospital in Barcelona. In this session, we will talk about feline triaditis. So, Jordi is an expert of his area, so I encourage you to ask him everything you want. So you can do it in the YouTube channel you can see in the screen. And also remember that clicking on the link you can see download, you can download and have the presentation for this session. So I will not delay any longer, and we will start. So first of all, Jordi, why do you think that it's important to talk about this disease in cats?
Well, I think it's a really interesting disease, and I think there's a lot of controversy in this pathology. There are many things that we still don't know, and however, there are new studies that have been showing new ideas and show a little bit of more light regarding some etiologies or causes, or even treatment options that we have for these cats. So I thought that was a good opportunity to show what is the new things that's happening in this disease, and I think that hopefully will be of interest of everyone.
Okay, so I think that maybe it's a good idea to start with the basis. So maybe we can see in this first part of the presentation, what is feline triaditis?
Yeah, I think it's important to start with this question because I think that's important to understand exactly what we're talking about. Feline triaditis is a term that implies the concurrent inflammation of small intestines, pancreas, hepatobiliary system. The first case was reported back to the 75 at the University of Bristol and was published as a single case at Journal of Small Animal Practice, despite the only description from the pathology report was inflammation of the pancreas and biliary tract. The authors suggested that maybe there was an ascending infection of the biliary and pancreatic ducts from the duodenum, therefore opening to this new term of triaditis, so that something was going on between those three organs. You can see in this picture from the study, you can see, for example, that the nodules in the pancreas, you can see also the gallbladder was open and showed the thickened wall, and also that the biliary duct was dilated and tortuous. Of course, there have been lots of studies since there. I think that one of the most important one is, this one was published in '96 with lots of cats with this combination of disease. But also it's something important that I want to mention, and we're going to talk about that later on, that many of those cats also have an involvement of the kidney presented as nephritis. Therefore, we have to talk about a multi-organ disease rather sometimes that only the conquering inflammation of three organs. Sometimes can be more than that. I think it's important also to understand the prevalence of this disease. However, we have something that we have to discuss that unfortunately most of the studies, they have a retrospective nature because they are based on necropsy studies, so there are lots of limitations when we read these papers. Also, most of them, the lack of standardization, we're going to talk about later on about the World Small Animal Veterinary Association guidelines regarding the histopathology changes of the liver. So most of them, they didn't follow any standardization of what is, in terms of what is a normal or abnormal liver. When we talk about bias, we think about that most of the cases, they started with a population, for example, feline cholangitis, and then from that population, they look for concurrent diseases for example, like inflammation of the intestines, pancreatitis. And these data cannot be applied to the real world because we already started from a biased population, that cats, for example, with cholangitis, we cannot talk about that this is the overall prevalence of this disease. Of course, there are different studies, different ways to do that study. That means that we had different studies designed. So this is why we have to be so careful when we compare data between those studies. There are some studies that they look at cases that they suspected Triaditis, and something that was quite common, and is quite common, that not all of them have Triaditis. We're going to discuss, and I'm going to present the data from this paper that we're going to mention several times during this presentation, published in 2016, that overall, I think the idea we have to keep in mind that that study, only 30% of the cats that the author suspected to have Triaditis had really Triaditis. On the other side, many cats have no clinical signs. What does it mean? The same study, for example, they took healthy cats that underwent ovary hysterectomy, and they took biopsies of the liver, pancreas, and intestines. And they found that 50% of these healthy cats had histopathological changes in 2 or 3 organs. So some cats can have inflammation of those organs without having clinical signs. We're going to talk about later on and see what does it mean and how can we interpret and how can we apply this data in our clinic. We're going to start talking about inflammatory liver disease. Again, it's remember that we have to always follow what it is the World Small Animal Veterinary Association guidelines. And when we talk about cholangitis, it's a group of acquired, I will say, inflammatory disorders of the biliary tract. But when we have an involvement of the hepatic parenchyma, we're talking about cholangiohepatitis. The scheme that was presented several years ago, this is the book that was published around 2008, 2009. Nowadays is a free version in the website that has been, because it has been updated. They talk about 4 types of cholangitis: the neutrophilic, the lymphocytic, the fluke infestation, and the destructive cholangitis. The last one has been reported in dogs, but not in cats. Also, it's important as a clinician that we think that FAP, toxo, can be a cause of cholangitis. We know that they are less common, but that are important. So we have to keep in mind that. Yeah. Inflammatory liver disease, we talk about the neutrophilic form and the lymphocytic form. Neutrophilic form, it's the most commonly reported in the veterinary literature. Is usually we have a bacteria that we can isolate, and because we think, and there have been data that prove that this is an infection happening in the liver. Most of the time we have some pancreatitis concurrently. And regarding the age, there's no data that show us that maybe they're young or more adult. So there's not consistent data. There are cats that are presented from an acute presentation in our clinic. And from this pathology point of view, it's true that they classify between acute and chronic. However, I think that it doesn't matter too much for us when we see these cats in acute or chronic, because from a clinical point of view, it's not going to change anything. So we like at the end to put everything together. And also it's important, this neutrophilic form, sometimes it's, we have predisposing factor or comorbidities like cholelithiasis, Crowley ductal plate malformation, or any extrabiliary duct obstruction. Those things happen with neutrophilic inflammation of the liver. When we talk about lymphocytic cholangitis, we think that it's an immune-mediated disease. Studies back in the 80s, in the UK, they thought that maybe Persian cats were overrepresented. However, latest studies, they didn't show the same results. We think that maybe even it's an immune-mediated cause, we maybe have transient bacterial infection that triggers an autoimmune response, something that we don't know for sure, but it's something that we suspect. Regarding the age, again, we have to say the same as the neutrophilic form. Unfortunately, we don't have consistent data, but more and more we see that with more adult cats. It's more a progressive presentation rather than acute presentation. And we have to think always, as the main differential diagnosis of these cats is lymphoma. There are two interesting points I want to share with you. The first one is the fish, and the second one is Helicobacter spp. Yeah. So about fish, its first sense in situ hybridization. It's when we take a sample, biopsy sample, and we want, for example, look for a bacteria. We can apply this technique to any biopsy. So they did a study back in 2014 by several authors with Candy Simpson and others with 39 cats with inflammatory liver disease and 19 control cats as a control population. So they were looking for bacteria in those livers, and they found that most of the liver inflammatory liver disease, they had some bacteria, but also 3 out of 19 control cats had some bacteria. But those cats were including cats with contamination, that we thought that there was a bacteria that was a contamination during the procedure of taking the biopsy, etc. But when we get the only enterohepatic bacteria, the ones that we take care, the inflammatory liver disease, it was 41% of the cats, and only for 6% was in the control group. I think the most important key message of this study is that intrahepatic bacteria were located mainly within the portal vessels and sinusoids. So that changed a little bit the idea, and what the author suggested, and I think it's really important, is that colonization likely occurs by the enteric translocation or by hematogenous means rather than the typical or just ascending infection of the bile duct. That means that this is something more than just an ascending infection. What about Helicobacter? They've been found Helicobacter in the liver and bile of cats with inflammatory liver disease. However, we found Helicobacter in livers of cats with non-inflammatory liver disease, like, for example, lymphoma, but also healthy cats. Therefore, we don't tend to look for that disease. What about pancreatitis? We talk about liver. Now we move on about pancreatitis. What's going on there? Unfortunately, most of the cases, the cause is unknown. It can be acute and chronic. However, we keep, unfortunately, having most of the cases with calling them as idiopathic. That means that we don't know really why this is happening. There's been studies that showing that up to 60% of the cats, as a post-mortem study, having lesions, inflammatory lesions in the pancreas. That raises two questions. Maybe we have subclinical pancreatitis in healthy cats, or maybe we need to change what we think that it's abnormal in the pancreas, and it may be normal. I mean that some degree of inflammation when they get old is normal, and we cannot call them as true pancreatitis cats. How can we differentiate between acute and chronic? We're going to talk about later on when we talk about diagnosis. Of course, that the best way is to do biopsy, but it's something that we don't do on a regular basis. But it's the best way. I will say that it's the only way to differentiate. Some authors suggest that between acute and chronic is the same disease but different time points, because we know that acute can go to chronic. We know that some chronic disease can have flare-ups and have acute on chronic. So there's still a lot of questions that remains unsolved. What about bacteria? We talk about bacteria in the liver. What about bacteria in the pancreas? Again, this was not really a publication, it was an abstract at the ACVIM 2011. And they found that bacterial colonization was more frequent in cats with moderate or severe pancreatitis, 13 out of 46, versus cats with only mild pancreatitis. They suspected also a translocation rather just an ascending simple infection. Something to keep in mind, especially when we talk later on about why Triaditis is happening and also how do we treat those cats. I think more about pancreatitis. We know they have an acute form. It can be a necrotizing with higher mortality, is the most common one. But also we can have the suppurative form that is less frequent. We see that more in young cats. Overall, the mortality, of course, depends on the study, but it ranges from 9 to 41. Of course, there are many things that can change these numbers, many studies, and again, we have the same problem as we talk later on about so many studies with so many bias, different methods, etc. And finally, remember, we have a chronic form. This is really important to understand because this is the most common. Remember that also diabetes and exocrine pancreatic insufficiency can be consequences of this chronic pancreatitis in cats. This is a list of the proposed causes of acute or chronic pancreatitis. And we see a long list from pancreatic ischemia, ductal obstruction, infectious agent, etc. Yeah. In our presentation, we're going to talk about concurrent biliary or GI tract disease. We talk about Triaditis. But something that I want to point is that nowadays something that we know is that also colitis, something that we didn't pay too much attention over the last years, can be a cause of pancreatitis. We can have colitis that are occluding even partially the bile duct, causing some degree of pancreatitis. And this is something that has been shown recently in a paper published by a Journal of Small Animal Veterinary Association by Sharon Center. Let's move on to the third player. It's what we say that the intestines, duodenum, jejunum, etc. We know that these are really a topic that there's a lot of debate. And we have to go back in 2010 because there was a consensus statement that the ACVIM trying to get an idea for the practitioners to know when we can apply this term to our cats, IBD. So they talk about that needs to be chronic presentation. You need to prove that there's some histopathology evidence of inflammation. That has not been any response or really a good response to any diet change, any antibiotic treatment or antihelminthic therapy, that there are no other causes of inflammation happening in the GI tract, and there is some response to anti-inflammatory or immunosuppressive agents. This is the consensus statement in 2010. However, in humans, it's absolutely different. It's completely different. IBD in humans, we talk about Crohn's disease, or you have maybe ulcerative colitis. And it's completely different from dogs and cats. Why? Because the anatomical distribution is different. The inflammatory pattern is different. So it's something completely different when we talk about IBD in dogs, cats, or in humans. Therefore, nowadays, I think we are using an indiscriminate, from an indiscriminate way, this term, IBD, and that is causing a lot of confusion. Therefore, some authors, and more, they are more keen to talk about what we call feline, or canine, of course, chronic enteropathy. It's a broad term, but it gives you less confusion. So I would prefer just to talk about feline chronic enteropathy Why? Again, it's going to be easy for us. I'm sure that everyone is thinking now from home, like, okay, another acronym. We have so many acronyms that things are getting a bit more confused. But I think that's going to help us. The definition, it's easy. It's more than 3 weeks of GI signs in the absence of any extra lumen or extra obstructive causes of intestinal disease. Again, it's quite simple. We have inflammatory but also non-inflammatory disease. And what's in the box, just to make simple? Food responsive enteropathy, immunosuppressive responsive enteropathy, quite similar when we talk about IBD, but we prefer to give this name. But also small cell lymphoma can be in this box. Of course, others like non-responsive enteropathy. Unfortunately, there's no official scheme exists, so things may change over next years, but we have to keep this in mind that I think it's a good way to go. So why I use feline chronic enteropathy rather than IBD? I think because sometimes it can be difficult or it's not possible to get some biopsy samples, so we can suspect inflammation, but we cannot prove that. Also, it does not interfere which treatment I'm going to use. How many cats we have that we start with steroids and we diet, we remove the steroids, and the cat is getting better? Are we talking about what we call before IBD or a food responsive enteropathy? I think that gives us less confusion. We talk about feline chronic enteropathy. And also because sometimes inflammation can be really small, can be minimal in these guys. And what we have is more structural damage rather than inflammation. Yeah. About feline chronic enteropathy, remember that it's a complex interaction between the microbiota, the genes, environmental factors, immune system. That has been really showed in humans, and I think that it's something important to keep in mind that when everything falls or everything doesn't work is when we have clinical signs. We mainly have lymphoplasmacytic enteritis, but also this can be seen in many cats with, for example, hyperthyroidism, food hypersensitivity. So be careful when you overinterpret inflammation in the guts. Be careful with lymphoma. We're going to talk about later on. Cats are not dogs. They can have feline chronic enteropathy. Also, they can have lymphoma in the GI tract, and with weight loss and anorexia as the only signs. Of course, they can have vomiting and diarrhea, of course. But cats sometimes are a little bit more difficult to know what's going on. And remember that the small intestine is where the bacteria reside, where they live. So this is why when we're going to talk about the disease of Triaditis, we have to think about that most of the bacteria that we see in the liver and the pancreas, they come from the intestine. So we have to take care of these intestines.
Thanks, Jordi. I think that it has been a detailed explanation. So the next question, and it's linked with the first part, it's why liver, intestines, and pancreas are or tend to be affected together. There is any reason that explain that?
Yeah, we have several explanations. Of course, that we have several hypotheses. Again, the most accepted theory is that we have a common channel, and this is why we have cholangitis and pancreatitis together. If we remember that the anatomy in dogs, when we talk about the canine duodenum, we have the pancreatic duct and we have the bile duct that goes in this parallel, but they don't cross, and they have an entrance in the canine duodenum separately. What's happening in cats? Cats are different. Cats have the bile duct and pancreatic duct that joins together before going in the feline duodenum. Therefore, if we have an inflammation of this area, an infection, it's quite easy that the bacteria goes to the pancreas, to the bile duct. This I will say that it's the most common accepted theory, also the oldest one. For example, when we have a reflux duodenal content because we have a pressure, because we vomit, this can happen easier. But also, for example, if we have an obstruction, we have an increase risk of liver infection. For example, because we have a mechanical or functional, it's not always something like a mechanical. It can be that the opening, it's not working properly, the papilla. Yeah, and also, as we said, we have some cats with microcololiths, debris in the duodenal papilla that makes this papilla not work properly, causing an increased risk of liver infection, as has been shown with cholangitis. We have new models nowadays that tells us a little bit more. Yeah, I would like to share these models that were published by Kenny Simpson back in 2015 in a good review called Pancreatitis and Triaditis in Cats, Causes and Treatment. The first one is that it tells you, okay, we have a dysbiosis in our intestines. We have an inflammation of the mucosa, but also really important, we have a bacterial translocation. In this bacterial translocation goes to the liver, but also the pancreas, causing a suppurative pancreatitis, causing a neutrophilic cholangitis. It can be also in the same cat, we have some degree of reflux, as we were talking about. But again, opening the door to new ways to understand this disease and why this is happening. Yeah, and also that's something that we see that some cats, maybe septicemia, that means that we have some bacteria going on in the body, can play a role. The second option, the second theory that I think is quite interesting is that maybe everything starts with an acute pancreatitis. We know the pancreatitis can cause intestinal inflammation and reactive hepatitis because it's really close to those two organs. And from that point, everything goes wrong. We have neutrophilic cholangitis, we have an infection, an inflammation, dysbiosis, translocation, we have a suppurative pancreatitis, and of course, again, septicemia can play a role. And the last option, everything starts with a suspected dysbiosis / chronic inflammation of the small intestines, and we trigger an autoimmune disease. Again, it's quite complex pathogenesis, but I think the main idea is that is the suspected etiology of why some cats, they have more autoimmune-mediated pancreatitis or immune-mediated cholangitis, like, for example, lymphocytic, where maybe bacteria doesn't play too much a role directly, but, of course, indirectly in the intestines.
Thanks. Let's move now to the prevalence. You gave us some ideas in the first slides, but I don't know if you can give us more details about how common is feline triaditis.
Again, it is something that, as we said before, is something that it's really difficult to answer this question because, as we said, there's so many studies, different ways to diagnose, etc. We talk about during the second slide. Again, one study that I like always to mention, and it's something that I already mentioned that, and we're going to talk about later on, and we're going to talk about a lot because I think it's the biggest and the best study published so far. What they did is just to look at cats that they suspected triaditis from a clinical point of view, and then they took some biopsies to see if they were right, wrong, and see the prevalence. And the question, again, is 1, 2, or 3 organs, or even more organs are affected. So that paper gave us the answer that in some cases we only have 1 organ affected if they have the clinical picture of triaditis, or 2. For example, feline chronic enteropathy plus cholangitis was around 22% of the cats. Feline chronic enteropathy plus pancreatitis was only 7% of the cats. It's important to understand that none of the cats had cholangitis and pancreatitis without feline chronic enteropathy, and around 30% of the cats had triaditis. And this number, 30%, is something that we see quite often in the studies. It's the same study that I told you before that 50% of healthy cats, those cats that underwent hysterectomy, they were completely healthy cats. they had inflammation in 2 organs. None of them had triaditis, but it's quite surprising, this high percentage in healthy cats. And remember that we think that it's not only 3 organs, sometimes can be a 4th, that it's the kidney. Was studied already a long time ago, in 2011, with feline cholangitis. They did a necropsy study, 44 cats. They found a prevalence of 32% of cats with triaditis. But again, as we said, there's a big bias because they start with cholangitis and they look how many cats had pancreatitis, how many cats had chronic enteropathy. But again, it gives you an idea of the prevalence with some limitations. And the most important thing that I want to mention from that study is that nephritis, inflammation of the kidney, was around 81% of the cats. So this is why one of the reasons sometimes we see that these cats have some also renal issues. And just to make everything a little bit more complicated and to open, again, a new door for debate, is that, for example, the first study that I'm mentioning from 2016, they found that the most common form of cholangitis was the lymphocytic form. And about nephritis, the paper talking about cholangitis and nephritis, they found that neutrophilic cholangitis was the most common cause. We don't know why this happened. Of course, there are different populations, but we still have a lot of questions without an answer.
Okay, let's move now to the issue how to diagnose this disease and which challenges we can find when we try to diagnose feline triaditis.
Well, as we've seen that, we've been talking a little bit about that. Not all the cases are so easy, and not everything that looks like triaditis is triaditis. This is why sometimes, again, the diagnosis is really challenging. But I think that the main problems there are 3, in my opinion. First, an inflammation of those 3 organs, they have similar clinical signs. Second, if you want to prove and say your cat has pancreatitis, for sure you need pathology, and it's something that we don't have all the times. And problem number 3, that also it's a big issue when we treat them. Which organ do we think that is the most responsible or the guilty one for the clinical signs? Is the pancreas? Is the pancreas and liver? Is everything together? And sometimes this is difficult because for the treatment, but also for the diagnosis. We know that triaditis cats are older. We know that it's really rare to have pancreatitis and cholangitis without feline chronic enteropathy. And we know that feline chronic enteropathy is more severe if this is associated with cholangitis or pancreatitis. And finally, something I just want to just to let you remember that neutrophilic cholangitis and lymphocytic cholangitis may be associated both with an inflammation of the small intestine. It's not only neutrophilic or lymphocytic. Both forms can be associated with an inflammation of the intestines. I think that the most important thing that also we can take from these results that they are from that study from 2016 is that, and we agree, everyone, that the feline chronic enteropathy plays an important role, or I will say maybe the most important one.
Okay, and then related with that, with the last point you mentioned in this slide, how can we differentiate between neutrophilic and lymphocytic cholangitis? So if you can give us some points to
yes,
achieve
of course.
this.
Yeah, I think because I think it's sometimes it's especially not. I'm not talking about, for example, cats with triaditis. Some cats they come with only cholangitis, and sometimes it's difficult to know is this a neutrophilic or lymphocytic cholangitis because those diseases have different treatments. So it's something important to keep in mind and to know the differences. The neutrophilic form usually is more marked elevation of neutrophils, ALT, and bilirubin. Most of them, they're jaundiced, they feel really bad. In 80% of the cases, we grow some bacteria like E. coli, less frequently Enterococcus, but it's important too. And in order to get the best in terms of bacteria, we try to collect from bile and tissue. And when we take a sample from the bile, we usually see neutrophils. When we talk about lymphocytic, for example, pyrexia, something that we see in the neutrophilic form, it's uncommon. Some cats, they don't come with anorexia. The opposite, they come because they are really hungry. They have polyphagia and ascites with a big belly. We don't see usually neutrophilia. We see maybe lymphocytosis, a hyperglobulinemia. The globulins are quite high in these cats. And if you stick a needle on the gallbladder, it's quite rare to see lymphocytes. From the ultrasound point of view, something that most of us, we have in our practice, unfortunately, we cannot differentiate those two forms. Of course, if we have a content within the gallbladder, liver that is hyperechoic, dilation of a common bile duct, we may think that this cat has cholangitis, but we cannot differentiate between those two forms. And finally, regarding ultrasound, important to keep in mind that it can be a normal liver, but you may have a severe cholangitis, cholangiohepatitis. So how can I get a good sample of these cats? What we usually do is an ultrasound-guided percutaneous cholecystocentesis. Everything is written just to show you how to do it, but again, it's something I think it's important that when we take the sample, we like to empty the gallbladder so the possibility of a leakage and a bile peritonitis decreases. And it's important to get the sample for cytology and culture. Some authors suggested, and I think that it's right, that if you take samples from the liver, gallbladder, and if you take several samples from the liver, always get the most of it. That means that take a lot of samples and also send them to the lab for culture. You have more. It's more likely you to have a positive if you send more samples to your lab, including, for example, the crushed coleliths that sometimes they have bacteria inside. Yeah, or for example, especially when you take the gallbladder out, or you take a sample of the gallbladder, take especially the part that we have more mucus rather than the bile that is more liquid. That's going to help you to get good results of the biopsies, and of course to know if is any bacteria playing a role, and of course which bacteria and which antibiotic. And in most of the cases, please try to avoid true cut. It has been associated with a lot of complications in our experience, and I think it's much better to perform a surgery, and sometimes can be quicker and safer. Let's move on to the diagnosis of feline chronic enteropathy, and I think it's important to ask us this question of how to get the best GI biopsy. We know that it's not a really clear answer because there's a big debate between performing a surgery, performing an endoscopy. However, we have to think that several years ago, they published some guidelines regarding what is the normal biopsy of the gastrointestinal tract of a cat or a dog. And that was published according to young cats who were less than 2 years old, pathogen-free. So what happened with this scheme that was published by the World Small Animal Veterinary Association, if it represents the real world, because we have to think that most of the cats that we see and we take a biopsy, they are not so young. They are more like 9, 10, 11 years old. So there was a study published 3 years ago that tried to solve this question and to see how is a normal cat like that is more like the cat that we are seeing in our practice with some GI signs. So they took 20 healthy cats with a median age of 9.5 years. All of them were healthy. What does it mean? They had CPLI, TLI, folate, cobalamin, normal. They had a good body condition score. So they took some biopsies of these cats. So what they found, and was really surprised for us, that in all of the cases, the pathologists, they saw some inflammation, and in 2 of those healthy cats, there was a diagnosis of lymphoma. When they did the PAR, they found 8 positives. 5 they were unclear, and 6 polyclonal. So if we put everything together with immunohistochemistry, biopsies, but also PAR, they diagnosed 13 cats with lymphoma. It's important to understand that they follow these cases, and when they followed those cases, they saw that only 3 cats developed signs of chronic enteropathy, and only 2 died. And those that died, they were those that were diagnosed from a histopathology point of view of lymphoma. And I think the take-home message of this study, that has been really a big study for the conclusions, but also for the results, is that maybe the WSABA criteria regarding what is normal and what is abnormal needs to be changed, especially when we talk about cats that are older than 2 years old. Maybe we have some cats with subclinical disease, as we saw in pancreatitis, and we have to understand that this is a normal aging process, or maybe we are not able to see these clinical signs in our practice. But also, something that is the PAR sometimes have low specificity. That means that if a PAR is positive, it's not always a tumor cancer going on. We've seen that in leishmania, in leishmaniosis in dogs with PAR that are positive. So be careful with reading only PAR. What about diagnosis? Unfortunately, it's difficult to differentiate between chronic and acute form. We have a table about clinical signs that's quite obvious for everyone. We see that on a regular basis. The clinical signs and the physical examination findings can be really broad and non-specific in most of the patients. So what do we know about the diagnosis of feline pancreatitis? We know that the gold standard is a biopsy, but we don't have this biopsy most of the time. So most of the cases, it's a presumptive diagnosis. What about SPEC FPLI? The FPLI that we send to the lab, the one that we don't do in our practice, is the one that we send to an external laboratory. The most important thing is that we have a higher sensitivity in acute pancreatitis, so it's important that we know this limitation. And of course, we see lots of numbers with different percentages depending on which study are we reading. And one of the reasons is because each study has a different way to diagnose pancreatitis. Some authors said that pancreatitis was according to a biopsy. Some authors said that pancreatitis was when they had some clinical signs and some ultrasound findings. So this is why we have so many different numbers. If we assume, for example, that 10%, as many authors suggested, is normal, of 10% of lymphocytic infiltration in a pancreas, this changes completely the full picture, because this increases the sensitivity and the specificity. And it's something that we think that it's normal in cats. What about the SNAP FPLI? There's not too much literature about that, but overall it works quite well. Around only 10% of the cats, they have discordant results. And most of them, they have a false SNAP FPLI. So if you have a false SNAP, and you still suspect pancreatitis, then I think it's a good idea to maybe run an SPEC FPLI. We don't do cytology on a regular basis, maybe mainly when they are acute and we suspect neoplasia or infection. What about biopsy? We mainly do biopsy also in a chronic cases, and what we see, it's a fibrosis, we have a lymphocytic infiltration, and also we have multifocal distribution. And this is why some cats with SPEC F. pili or SNAP F. pili that have a chronic form, they have a false negative because they have a low lipase. And finally, when we perform a biopsy, we try to recommend to do the 3 regions of the pancreas. If you don't have time for taking those 3 regions, or for any other reason your surgeon is not comfortable and you have only to pick one, get the left limb, because you have more chances to get a diagnosis. Of course, be careful with hypotension and be gentle with the pancreas. What about ultrasound? We see many times that they can have pancreatic enlargement, changes in the way that the echogenicity, a mass effect when you see this hyperechoic peripancreatic appearance, or even free fluid. However, it's really important that not all changes are pancreatitis. For example, when we have a nodular appearance of the pancreas or some increased diameter of the bile duct, the pancreatic duct, this cannot be overinterpreted as pancreatitis. They can be changes that are related to the age. What about sensitivity and specificity? It depends on the study, but again, it's around 24 to 84 of sensitivity, and specificity it's better than the sensitivity. That means that if you see a normal pancreas, please do not rule out a pancreatitis. What about key points regarding negative prognostic factors that has been shown in a recent paper? We know that hypoglycemia, ionized hypocalcemia, azotemia, or even pleural effusion and anorexia are negative prognostic factors. The last study that I think with 157 cats, they showed a 22% of mortality. These are huge numbers, and they are compared to humans. I think that it's quite high, but again, of course, depends on the studies. And in that study, what they found is that antibiotics were more frequently administered to survivors. And remember that we talked before that maybe the bacteria is involved in some cases of more severe pancreatitis, and we're going to discuss later on about that in the treatment.
Okay, thanks. Let's move to the treatment. I don't know if you can share with us your experience about which is the best treatment for this disease.
Yes, again, I think it's the treatment again is what we want to do at the end. So we are quite at the end. We try to do our best in terms of getting the best diagnosis. It's important to understand why everything is happening, but at the end, what we want to do is to treat our patients. Yes, this is what this is our main goal. So the general overview of the treatment, I think we have to think about the common scenario. Is that many times we don't have biopsies, or maybe we have sometimes some cytologies, but it's not quite common to have biopsies of the liver, pancreas, and intestines. And also, we have to think sometimes that maybe we have biopsy of the intestines, but we don't have other biopsies of the liver. And for example, think about the case of you took a sample of intestines and you have an inflammation. So you think you have a chronic enteropathy. You want to treat with steroids. But on the other hand, you have a suspected neutrophilic cholangitis because the ALT is high, bilirubin is high, the cat is a bit jaundiced, but you didn't take a sample of the gallbladder, or you don't know if your cat has an inflammatory pattern in the liver. Are you going to treat these cats with steroids? Or maybe what it's the best way to go is to treat these cats before treating with steroids with some antibiotics, because you suspect that this cat is going to have has some chronic or cholangitis. Because can you imagine what's going on in a cat with acute or chronic cholangitis that is neutrophilic and has some bacteria, and you give steroids? So it's something you have to avoid. So think about the picture even you don't have the final diagnosis. Yeah. So for example, start with some antibiotics, and then a few days later you can start with steroids to treat the inflammatory lesion in the intestine. So be careful when you treat those cats. You have to integrate everything: clinical findings, lab findings, imaging, cytology, biopsy, culture. But remember, those cats, usually they don't feel really well, so you have to control the pain, you have to control the hypokalemia, vomiting. So those things are also important. Yeah. What about the treatment of feline chronic enteropathy? Let's move on. So the treatment needs to be organized as the diagnosis. Sometimes you see some neutrophilic inflammation. Don't worry. Most of the time it's a part of the feline chronic enteropathy. It's a form of the inflammatory disease. But in these cases, please look for Campylobacter coli, because it can be a cause of neutrophilic inflammation of this intestinal mucosa. The main differential diagnosis, we've seen that it's small cell lymphoma, but be careful with PAR because you can have false positive, and you may think that your cat has lymphoma when it's the opposite, it has just inflammation. The diet, I think, is extremely important. We see more and more cats that they are controlled only with diet, so think about that before moving to give steroids or chlorambucil to your cats. What about antibiotics? We know that they may work in dogs, but we don't have these results in cats. It's important, the B12, cobalamin. We love this vitamin. We always take care of this vitamin. We always look for this vitamin. If it's low or if it's high, it's something to be worried, especially these cats usually low. And the supplementation can be done oral or parenteral. Usually we use cyanocobalamin, but also as in humans, you can use hydroxycobalamin. This study that showed that 4 doses of 300 micrograms per cat IM every 2 weeks works well. But also you can give oral. The problem is that you have to give every day. So sometimes as a cat it's not too easy. You can give prednisolone 2 mg per kg, or if you have side effects with the prednisolone or you're not happy with the result of prednisolone, you can change to chlorambucil.
Okay. If we focus on pancreas, my doubt or my question is that once we have been treating the pain, what else can we do to improve the situation of these cats?
Yeah, things that sometimes when we think about pancreatitis, it's like, okay, it's only pain and they can go home, and I think there are many things that we can do. The treatment of pancreatitis, of course, mainly it's symptomatic and supportive. There's not a pill that treats the pancreatitis. Unfortunately, we don't have this yet. We're going to give IV fluids, analgesia, things to stop them vomiting and feel sick, and of course, enteral nutrition if it's needed. What about omeprazole, the proton pump inhibitor? The consensus statement from 2018, they found no evidence at all to give these cats omeprazole with pancreatitis. And something that we give maropitan, that it works really well in cats and dogs, but also we can give other antiemetics like ondansetron, and it works well as add-on medication. In healthy cats, we know that subcut is better than peros or IV, and the question of how often, it's 3 times a day. However, in cats with liver disease, we have to give it twice a day, not 3 times a day, because this drug is metabolized primarily by the liver. So we have to reduce the times that we give this medication to these cats. What about antibiotics? We've already mentioned that before, and the consensus statement of pancreatitis said that there was no evidence, and it's true. We don't have a huge evidence that we treat these guys with antibiotics. But remember that we talk about that bacteria was present more in cats with high severity of pancreatitis, and there's a study that showed that cats we treated with antibiotics had higher survival times. So maybe they represent an option in severe cases. I'm not saying that now every cat with pancreatitis needs an antibiotic. However, what I'm saying is that in some severe cases that are not responsive to the treatment that we're giving, it may be an option. What we do in the chronic form that we don't have evidence of neutrophils, we don't have evidence of infection. We can give prednisolone, or even has been shown in 2020 as an abstract at the AECVIM, the use of cyclosporine in these cats. If we move to the cholangitis, we usually start treatment with vitamin K. Remember about the deficiency of vitamin K in these cats, so it's important to give them. Especially we have to take biopsies, cytology. While we're waiting for the results, especially with respect for a neutrophil and neutrophilic cholangitis, we can start with some antibiotics. And those cats with a lymphocytic cholangitis and the culture is negative, we recommend to start with steroids. Prednisolone, 2 mg per kg, once a day, it's a good option. Again, if you don't have a good outcome, we have some side effects that we are not happy with, the second option is chlorambucil, 2 mg per cat every other day is what we use on a regular basis. Of course, you can give any antioxidant or UCDA, but again, remember that you have to avoid the polypharmacy because sometimes it can be difficult to pill these cats. And it's something that also I want you to remember that you have to be careful with what we call cholangiovenous reflux. That is when we have a dissemination, and it's a really acute dissemination of endotoxin and bacteria. And this can happen during the surgery, but also during the hospitalization period. And this is really dangerous because you can have severe complications. And finally, last but not least, it's like if you have a cololith in the pancreatic duct or common bile duct, you have to remove it. And what also it's important that you have to remove the gallbladder, because it has been shown in a recent study that this was more common than what we thought, and you have to think where it comes from. Most likely it comes from the gallbladder. So the cololiths that we see in cats, they form, most of them, in the gallbladder. So if you remove the gallbladder in these cats, it's quite easy that in a few weeks, months, or years, you're going to have further cololiths, and it can cause a big problem. And we can have lots of problems. Sometimes we have partial or complete obstruction of the bile duct. As you can see here, for example, you have an stenotic common bile duct. You have the gallbladder. You have the common bile duct dilated. You have the duodenum. And what's going on there? We have a stenotic common bile duct. Those cats, they may need, for example, gallbladder resection, stent placement, or in this case, what we did, of course, we were not able to place a stent here, so the surgeon, what she did is a cholecystoduodenostomy. Yeah. So just to finalize with and to end with my presentation, I would like to present you a case that hopefully we're going to put everything together and everything that we've learned over the last minutes. We have Tim. He's a 3-year-old male neutered Siamese, 7 days of vomiting, hyperexia, and weight loss. And the field examination was abdominal pain, jaundice, and high temperature. We have the blood results with some inflammation going on and some increased liver enzymes, ALT, ALP, GGT, bilirubin were quite high. So what's next? what we do in these cases, I will highly recommend to do an ultrasound. And we saw a dilation of the bile ducts, a heterogeneous liver. We saw an heterogeneous and thickened pancreas with peripancreatic hyperechogenicity. And also, when we look at the intestine, we saw a really thickened wall, mainly the muscularis layer. Remember the blood test. Remember that we have a presentation of 7 days of vomiting, hyperexia, and weight loss. So it's something that we cannot forget. We have a highly suspicion of triaditis, but remember, we need a biopsy. We have other options like lymphoma in the GI tract. We may have a pancreatic carcinoma. So what we did is we offer the option to the owner, like we can do a percutaneous cholecystocentesis, checking the B12 or and adding a multimodal treatment. But option 2, we asked them if they wanted to do some biopsies. It's something really important, and I think that one of the most important things in this talk is that option 1 and 2, we have to think about nutrition. And a common mistake in these cases is no nutrition plan during the diagnostic workup. And the diagnostic workup may last for several days, and this cat has been with several days of anorexia. So the owners decided for option 1. We diagnosed a neutrophilic inflammation doing a percutaneous cholecystocentesis with a low vitamin B12. We gave a full treatment with amoxicillin clavulanic, B12 injections, maropitam, mirtazapine, buprenorphine for the pain. We placed a esophageal tube. The plan was to start a hypoallergenic diet in this case, but we thought that wait a little bit because we don't want to start this diet when they are not hungry in the ICU, but this was our plan. And in this case, it worked. Team improved, but we didn't have any biopsy. Are we talking about triaditis? Because I'm treating with antibiotics, maybe a neutrophilic cholangitis. We may give, we were giving hypoallergenic diet. Maybe we were treating a chronic enteropathy that was responsive to diet. So we were reducing the inflammation given a hypoallergenic diet. And we were treating a suspected pancreatitis. But again, sometimes things do not work as we like to, and sometimes we have to send it to surgery. So I will say that option 1 or option 2, one or the other is the best and the other one is the bad one. But again, it's something to understand that we have to work according to what the owners want, but also on really organized way. As we said, the common mistake is no nutrition plan during the diagnostic workup. Nutrition is really important in these cats. We place a esophageal tube. In my experience, is the best option. We have to think that we can give pharmacological appetite stimulation, but this does not exclude the enteral feeding options. We have to treat the pain, nausea, ileus, fever, whatever is going on in these cats. We need to address this first. So what we've done so far, we've done a good job because we placed a esophageal tube. We gave a treatment against fever, possible infection. We had a good control of the pain. We stopped the nausea, and we gave some appetite stimulants. So we were quite happy because our midterm plan was to encourage the oral feeding, especially with this, in this case, with hypoallergenic diet, but also our idea was to remove the esophageal tube because that means that the cat was eating by his own.
So, Jordi, related with this case, what can I offer if the patient is not eating then?
Again, when the patient is not eating, I think that we have several options nowadays. We have mirtazapine is the drug that we more commonly are using nowadays, and it helps the appetite really well. In healthy cats, we know that 1.88 mg, or I would say 2 mg per cat, it's safe and effective. But we have to think that what we see And what we have available is 50 milligram tablets of mirtazapine, and to do an eighth of a tablet, as you can see in this picture, it's quite difficult. Some people think give 1/4, but we know that if you give 1/4 of a tablet, you have more side effects like agitation, vomiting, vocalization, tremors, so we don't want that. So what do we know about mirtazapine in cats with liver disease? That we have to give it less often because we know that we have a prolonged half-life in these cats. Nowadays we have the mirtazapine transdermal ointment in cats, and the dose is the same. It's 2 mg per cat once a day, and it has less toxicity, but the same efficacy. So it's something that we use on a regular basis in our clinic. What happened with Tim, that the owner reported some vocalizations and tremors at home, and what happened is that they were giving most likely a higher dose than what we wanted to give. And this is why it's so important that we moved from the tablet to the transdermal ointment. So I originally used this drug. We have to keep an eye on a patient because we know that it's safe with liver disease. Even we still need more studies to prove that. So you have two options when you use this medication. You have option A, you give the dose that is in the leaflet, or you give a lower dose and increase if you have no side effects. So far, I use more option A than B, and we've seen that these cats, they do pretty well.
Okay, then let's move to the last question of this session, and it's a doubt that it's coming quite often from the vets. So how common is the exocrine pancreatic insufficiency in cats?
So what we thought is that this doesn't happen to cats, and because people thought that this doesn't happen to cats, no one was checking FTLI. That is the best way to diagnose feline exocrine pancreatic insufficiency. And it's something that is happening, it's always been happening, but nowadays, because we are more prone to test this disease, we have more cats with exocrine pancreatic insufficiency. And guess that the most common cause is a chronic pancreatitis. Yeah? So when we have chronic pancreatitis and your cat is having diarrhea and is not doing really well, is having anorexia, then again, I think it's good to check the FTLI. Overall, the low cobalamin is around 77% of the cats. So this is important to check if they have the cobalamin low. And of course, if it's low, you have to give cobalamin to these cats. So the treatment overall, it's enzymes and vitamin B12 and highly digestible diet with overall a good to partial response with most of the cases. Unfortunately, I will say 1 out of 10, they don't do really well, but in my experience, because they have concomitant diseases or they don't want to eat the food with enzymes, that will be the common scenario of having a poor control of this disease. So just to finish this presentation, I will say that cases can be difficult because most of the time the pathophysiology is complicated, and we don't know why this is happening, and we talk about that. Most of the cats, we don't have a liver or pancreatic biopsy, so we cannot confirm 100%. Sometimes empirical treatment is a good option. We are not doing a bad medicine. We have to think that it's not always 3 organs that are affected. We can have nephritis, for example, as we've seen in many studies. Do we need maybe another definition name? Maybe, but again, we still do a lot of things that we have to answer first. And what about low-grade lymphoma? It's also triaditis, which is not an inflammation, but we have many cats with pancreatitis, small cell lymphoma, in the GI tract and cholangitis. Again, maybe sometimes we think that we need to change this term or open this Triaditis term to more diseases. And I think that my last sentence, I think that I like to apply to this disease is that we have accomplished a lot, but we still have a long way to go and to understand how to treat them, what's going on, and what is the best for our patients. So thank you very much.
Thanks, Jordi. It has been really, really interesting. So we have been receiving some questions during the session. So I ask all the attendees to keep connected for 5 minutes, and we will come back now. Thanks. We are back. So, well, we have been receiving different questions. We don't have a lot of time, so we will answer one of them. But the other ones, you can send them to the email you can see below in the description of the YouTube. So, well, the question I would like to ask you, Jordi, is that related with lymphoma, could it be cured with a treatment of chlorambucil and prednisolone, which is your experience?
So yes, when we have a small cell lymphoma, we treat with chlorambucil. And in some cats, we have, I would say most of the cats, we have a really good response, and they live for several years. And in some cats that we achieve a complete remission of the clinical signs, what we do is on a regular basis, we check these cats and we give the treatment less often. For example, if we give it every 2 weeks at the beginning, then maybe we give every 3 or 4 weeks. And even in some cats, we stop the treatment and we wait if the disease reappears. But again, most of the cats, they have to stick with the treatment for life.
Okay, thanks. So thanks for being here with us today, and thanks all people to be connected to this session. We will come back after summer. This is the last one before holidays. And well, I hope to see you soon. Thanks.